Chronic Illness Therapist podcast. This is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learn here, and please consider leaving a review or sharing this podcast with someone you love. Are just kind of looking to learn the basics of acceptance work. What does it mean, and what skills can help you kind of lean into acceptance? We talk a lot about acceptance on this podcast and what it is and what it isn't. So I won't repeat that all here. But if you'd like to sign up for this membership, I'm still kind of figuring out exactly what it's going to entail, but I know it will at least have videos, training videos, and a transcription with each video, as well as like some worksheets when applicable. And eventually the goal is to have a community where people can chat with each other and kind of like a Facebook group, but I don't think it'll be on Facebook. I think it'll be on a different platform. So I'll keep you updated on that. If you're interested in learning more about that as I learn more about it and exactly what it's going to be, then sign up for the email list, and the link will be in the show notes. And I won't spam you with lots of emails, but just updates about what's going on in the membership and what it all entails. So thanks. Dr. Ginny Kington is a clinical psychologist who's been in private practice in Atlanta for over 12 years. While going through school, she trained mostly in university counseling centers, and after going into private practice in 2010, she focused on providing individual therapy and psychological assessment for ADHD, learning disorders, and autism. In more recent years, she's stopped doing psychological testing, and her therapy practice has focused on individuals going through major life events like chronic illness, trauma, and perinatal mood and anxiety disorders. In addition to individual therapy, she also provides diagnostic interviews with veterans to help determine whether they meet criteria for pension benefits from the military due to mental health problems they experienced related to their military service. Hi, Dr. Ginny. Thank you for being here.
You're welcome.
So, like I mentioned in the bio, Dr. Ginny is a clinical psychologist in Atlanta. Is your office in Atlanta or is it in Gwinnett?
It's in Duluth.
Duluth, okay.
Mm-hmm.
And you started working with clients. Actually, why don't I ask you to kind of tell us where you want to start as far as how you got started with working with chronic illness, and you can even talk generally about your own counseling, like trauma and perinatal mood, and kind of how did that evolve into chronic illness?
Sure. So I started working with clients in general in 2006, but I was trained as a generalist in university counseling centers and kind of continued that till about 2016. And then I started to get more interested in specializing, and was diagnosed myself with chronic migraines in 2016 and started getting interested in specializing in chronic illness as a result of that. When I was diagnosed, I was in therapy at the time and had a great therapist, but it felt like there were things that she just didn't totally understand, in a sense of like, just what that experience was like. It's, I think it takes an element of medical knowledge, and then also just like having gone through that of like, experiencing medical gaslighting and, just a lot of medical crap that you go through. And so I could imagine how it would feel really good to have a therapist who had been through something like that, no matter what your diagnosis was. And obviously, like, having chronic migraines doesn't qualify me to know what everyone's experience is like, no matter what their diagnosis is. But I feel like it gives me some insight into just the medical system and what that experience is like in terms of searching for a diagnosis and going through multiple treatments that don't work and having to like keep going through that and keep trying to find something that works. So I
Yeah.
started specializing. Well, I didn't start specializing right away because I actually had to take a medical leave because I couldn't find a treatment that worked. So I actually like wasn't working for a while. But when I finally got on Botox and was like starting to get things under control, when I came back to work, I started to focus on treating chronic illness. And then I really, I'd always been interested in trauma. And then I started to realize that like a huge percentage of people with chronic illness also had trauma histories, and that it really went hand in hand. And so I, furthered my training in trauma and got trained in EMDR. And so kind of kept those, going. And then I had my son. I had my son in 2011, and through that experience and knowing a lot of other moms and around that time and everything, and knowing a lot of people that struggled with postpartum depression and anxiety and everything, I knew I also had an interest in that. And so I really it kind of all ties together in the sense of like wanting to help people going through kind of major life events. It's like that transition of like, I used to feel like I had my life together and then something happened and like everything has been turned upside down, and now I'm here. So
yeah, there's nothing like a chronic illness or
yeah.
having a kid or both.
Right.
To say,
So
hey, the way you moved
it's
through the world no longer works.
exactly. And so so those are really my three areas that I focus on the most. And then anxiety and depression and stuff, all relationship problems, like all come along with all of that. But those are really my three areas. And then I ended up, I had the chronic migraines, and then nobody had looked at my neck for, I don't know why. It's the medical system, so no one has common sense, but nobody had looked at my neck for like a few years after I was diagnosed. And then they finally looked at my neck and they were like, oh, you have a bulging disc and you have these two things that are fused together that shouldn't be fused together, and that's probably contributing to your migraines. I was like,
Oh my gosh.
yeah, probably. And so now I get treatments for my neck, and then I got diagnosed with narcolepsy a year later. So
that is rough.
it was kind of like one thing after another. And so each time it was kind of that cycle of like, another thing, and having to adjust to it and having to adjust to different medication and, the whole thing.
Yeah, can we we haven't talked about narcolepsy on the podcast yet. Curious if you can tell us a little bit about that, and has anything improved with that? Does it stay the same? What is that experience like for you?
Yeah, so I'm lucky in the sense that I don't have the cataplexy. I don't have the like falling down like with a muscle weakness, which is always portrayed in the movies where people just like fall out, and collapse. So really it's excessive daytime sleepiness. And I've I went through a sleep study, and then you have to go through a nighttime sleep study, and then you go through a nap study during the day, and they time how long it takes you to fall asleep like just in the middle of the day, if you've had no caffeine, and it was like 15 seconds. Like
Wow.
it's like way too fast, you know.
Yeah. What is
And
for someone who has extreme trouble sleeping and hears that and says, wow, that must be nice.
well,
Can you dispel that myth, please?
well, I'll tell you, people with narcolepsy have insomnia too. So I have horrible insomnia at night, which is like this horrible twist of, you know, it's like this is this cruel joke of like, you know, at nighttime I'm like wide awake, like I, you know, can't fall asleep at night, but during the day, you know, I'm like ready to go to sleep. So it's very weird how that works. And but I had fallen asleep driving a couple times, and so, you know, it was like clearly like needed to get treatment because obviously that's not safe. And so they treat it, the medications are unpleasant. They're like, they give them to people in the military to make them stay awake for like 48 hours straight. It's like
Oh my
it's like these
God.
really intense medications, and then it's just stimulants. So it's like
Yeah.
Adderall or, you know, stuff like that. But it the withdrawal from stuff like that, you know, and I don't know if I'm just really sensitive to it, but it coming off of Adderall and things makes me like super irritable and anxious. And I finally found one really long acting one that I could tolerate. So I got to a place where I have a good combination of stuff, and it's, you know, it's in a good place now, but finding it was unpleasant. My boyfriend can attest to the fact that I was not the most
Yeah.
pleasant person to deal with for a
I
while.
guess that leads me to my next question. Like, how did you get through those moments? What was your support system like, or your coping
Yeah.
mechanisms?
Yeah. I mean, my boyfriend was a huge part of my support system because it's hard, you know, it's hard to like evaluate that when you're in it and try to, you know, evaluate if it's working or if, you know, am I just in a bad mood, or like, is this the medication or what, you know? But he could definitely tell like this, you know, seems like the medication. And when I talked to the doctor, they're like, yeah, this is like going through meth withdrawal, like it's what you're experiencing. So you would be cranky, you know. Um so so, you know, he was a big part of it. And in terms of helping me evaluate what was working and what wasn't, and what was tolerable, and when it was time to be like, you know, this isn't gonna
Yeah.
work.
So I'm hearing lots of
And-
compassion, which we talk a lot about, excuse me, on this
Mhm.
on this podcast. And it sounds like you had the experience of having a partner who was able to stay in that compassionate zone.
Yeah, definitely for the most part. Um and I've been in therapy throughout. You know, I found another therapist who had some experience with chronic illness, and that was really helpful. Um, you know, to have somebody who had some knowledge around that, and um, you know, could understand the medical component of what, you know, the things that were going on, um and just, you know, could be supportive in that way, um, which was a huge help,
Yeah. Um,
definitely.
then yeah, the medical knowledge I think is what probably starts to separate. It's the starting point for what separates those of us who specialize in chronic illness, because it really is, it's like learning a different language. And if you don't know it, you might inherently make comments that are like, you know, well, your doctor said this, like, and then you try to how can I help you just do what your doctor said? And it's like,
Right.
that's not quite that's not quite helpful when I have a chronic
Right.
illness in therapy.
Yeah, definitely. And I think it goes a long way. Like I have a couple of chronic migraine clients who, I know it goes a long way when they don't feel like they have to explain everything to me of like, I started this new medication and like, this is what it is, and this is what it's for, and this is what, and it's like, I know it goes a long way that I just know what they're talking about and they don't have to, spend 10 minutes talking to me about,
Yeah, like teaching you about it.
right, right. And, it's, I mean, I think that's really helpful for
Yeah.
them, definitely.
And I know on your when I was reading through your uh, interview form, you talked a little bit about dating, and so I'm hearing that your boyfriend was with you through some of excuse me, what you're currently or with your migraines. But can you talk
Mhm.
to us a little bit about that dating phase, and were
Mhm.
you sick when you were before you were in a relationship, and yeah, what was some of that like?
Mhm. Um, so I was married when I started. So if you want to talk about stress leading to the onset of chronic illness, I my migraine started in May of 2016, and I moved out of my house in October to get divorced. So, you know,
Yeah.
you can make of that what you will. um, and and my ex-husband was not the most supportive around the migraines. Like he wasn't like actively not supportive, but he just was kind of like, I don't know, just kind of annoyed by them.
Mm,
um or just
as
kind of
if they're some
didn't
kind of
get it.
choice.
Yeah, like it was kind of annoying to him that they existed. And um and I will say we have a much better relationship now, and we have a son, and he's always willing to like take my son if I'm sick and I need him to, and like we do much better living separately. So but yeah, it was hard dating, I think, and knowing like, like knowing kind of when to tell people or when to like, if you're on a date and you can feel one coming on, and it's like, not wanting to be like, I need to go home. Like I feel sick. You know, and I think that can be really hard. And I know for my clients it can be really hard of like when to disclose and how much to disclose, um and not wanting to hide it from people, but at the same time not wanting to like just come right out of the gate with it at the same time. And I think it's a delicate balance. And I I always think of I think it's a Brene Brown thing where she talks about like the marble jar, and it's like you put one marble in with like something you're vulnerable about, and they put one marble in, and like you kind of keep
Oh,
going back and forth, and it's like, you kind of like work your way up to
that's true. I
yeah,
hadn't heard that one
it's
before.
like this like gradual like give and take process,
That's right.
because
Can you expand on that piece a little bit for clients who,
Mhm,
because this comes up a lot in therapy,
mhm,
dating, chronic illness, when to disclose, and I like that example of the marbles because
yeah,
really, if you think about it, it really is. It's like anything else that you're talking about, but because it's
mhm.
such a big part of our lives, it feels it can be bigger, but it also I feel like is just another vulnerable marble that you're putting into this relationship jar.
Yeah. Yeah, and I think it depends on what the illness is too. Like I think because I think it's hard to make like a blanket statement about it, because some people's, you really can't hide from the beginning. And so it's like, it's right out there from the get-go, and, you're not going to be able to hide it.
Yeah.
So you might as well just kind of lead with it and like acknowledge the elephant in the room, like it's right there. But I think for something like migraines, it's, something you can wait a little bit and share, as they're sharing more personal stuff. And not, I think people have a tendency to like see it as this really big deal when it's them, and like it's going to be this deal breaker, and oftentimes to the other person it's like they're kind of like, okay. They often get this reaction from the other person that's just kind of like, okay, like that they don't have this huge reaction. And so, waiting a little bit and not just busting out with it right away, I think totally makes sense.
Can we talk about maybe some of the fears that come up on, on the end of the person with the chronic illness, like to what you just said, we have it in our heads that it's going to be this big deal breaker. In your experience with yourself, with clients, is this based on shame? Is this based on, improper or even proper perceptions of what it's like to live and what that means of the other person? Can we go into some of that?
Yeah, I mean, I think it's based on shame. I think it's based on the fear of being a burden. I think, they don't want to, put the other person out and like trouble them. And, but a lot of it is stuff that they could either ask the person, or that they need to trust that the other person will tell them if that's happening. And until the other person says something, like it's on the other person to say something. Like,
Right.
if they really are being a burden, that's on the other person to say, like, I don't want to do this. It's too much, like you're asking too much.
So there's
And
some assumptions I think that we make, like, one, it's going to be too much for them, and two, if we don't get that out of them to say that, they're just going to hide it, like they're going to feel burdened
right.
and they're not going to even say anything. And
Mm-hmm.
what are some other assumptions that come up for us?
Yeah. I mean, I think people think it's going to affect how the person feels about them. That they're not going to care about them in the same way, that they're, it's going to change their feelings. And just all kinds of things in terms of the other person's perception of them. And and a lot of times I think if you ask the other person, it's like it's not, nothing. It doesn't really change anything.
And what happens if let's say their assumption is right and it does change something? What is the way that you work with that internally? What are some?
Yeah, I mean, I think it depends on what it changes, but usually it's not it's not a disaster. It might change something in the sense of like, okay, they're not, immortal. They're not, like they could potentially get sick. Like there's, but it's something that would have changed eventually anyway. It's not anything that's catastrophic. It's just kind of a realization of like, this person isn't perfect. And oftentimes when I've worked with people, it's like, you're going to realize you're both not perfect. Like that realization is going to happen like at some point, I don't know when, but like it's on its way, like it's going to happen. So it's, it's just happening now, um yeah, usually it seems to be something like that like it's, you know a, a perfectly normal realization that's true, and
Yeah.
not catastrophic. It's just, a normal realization.
I'm hearing that the advice, I guess, is, we are so focused on if somebody's going to like us or accept us. Really, when you start to accept yourself more and know that it's okay to have, it's okay to, I don't even know the right way to say it, because I want to say it's okay to have imperfections, but that it gives the
Mhm.
insinuation that, we're imperfect because of whatever we're bringing to the table. But as you're saying, we're all imperfect. And this is
Mhm.
my stuff. You have your stuff. We're going to figure out we both have stuff. So
Right.
we just work on accepting ourselves and showing up to the table with that acceptance, knowing that if the person across the table doesn't accept me, there would have been something else anyway in the relationship where it would have been a deal breaker. Like that isn't going to work out.
Mhm. Exactly. Yeah. um and I think, just because one person has a chronic illness and that might be something they have to deal with, the other person's going to have something. Like, just because they don't have a chronic illness doesn't mean there's nothing wrong with them. There's like, there's going to be something
Exactly.
going on with them. They've got some kind of baggage. So, you know,
Yes.
um, it's might not be as obvious or something, but it's still there. So,
Yeah. I'm curious if you want to talk a little bit more about the beginning stages of your health journey, and that could be related still to
mm,
dating or not. But kind of like, what do you feel like you did right? What do you feel like you would have done differently? Yeah.
yeah. Um, I feel like I did the best I could to find medical professionals to help me, but I wish I had like somehow, um it's like, I don't think I could have, but like I wish I had, found different people, because I had some really bad experiences. And I I had a I had a guy at the Shepherd Center that I saw, and I was like, it's the Shepherd Center, like it's, the Shepherd Center, it's amazing, whatever, who told me I didn't have migraines and he wasn't going to give me opiates. And that was our whole conversation. And I was like, what? Like, what?
And I want to even clarify, did you even ask for them, or was that just like out of the gate?
No, that was
Yeah.
just what he said, and I
Yeah.
was like, what are you talking about?
Oh my goodness.
And then,
That's and the reason why I even knew that you probably didn't ask to begin with is because I've had two clients tell me, not from the Shepherd Center, but from different doctors, where that was right out the gate what they said. And it's like, dude, I'm not even looking for pain meds. Like, can you just
yeah,
help me?
and migraines are like classic, because I've been to the ER so many times for migraines, and like they it's like such a pill seeker, because you can't test for it. You can't, like prove it. And so it's such a drug seeker thing.
Yeah.
So you just get treated like shit. Um, but the guy, oh, he was so weird. And he he then gave me trigger point injections in my neck. And when I had side effects, my whole arm went numb, and I called his office, and the nurse said, he doesn't want to see you anymore, and just like fired me over the phone. It was so weird.
That's
So,
traumatic.
like,
So traumatic.
I had some experiences like that where I was just like, and I was doing what he wanted me to see the pain psychologist and do physical therapy. And I had signed up for that, and I was like going. And so I was like, I don't know what else you wanted me to do.
Oh my gosh. It sounds like an ego thing,
So
right? He couldn't figure it out, so he put the onus on
completely.
you.
So just, like, I don't know that I could have done anything better. Like, I was trying to like go to the best place I knew of, and like,
I will say, like, as far as that, because I want to make, for people listening, like, by the way, there is well, she works in the MS department, but there are some really great therapists at the Shepherd Center that I know.
yeah.
But even like I've heard stories about this from Emory, from Mayo Clinic. And the reason why I'm, I guess, eliminating the names is because, like you said, you think it's like this big prestigious place, but the people working there are all just normal people who have their own shit, their own egos, their own triggers, their own lack of
Right.
education or education. And
Mhm.
you can get really lucky going to your local ER, finding some doctor
Right.
who hasn't been burnt out yet and really gives you some solid advice and gets you help. And then
I
you can go
mean,
to a place like Shepherd or Mayo and have
that's
your
what happened. Like, I went and saw a neurologist who was good, and her partner, and then I had to switch, I think because of insurance or something, I had to switch. And then I got hooked up with my current neurologist, who I adore, who, like, when I first met him, he just sat down and was like, tell me your story. Like, tell me the whole thing. And like, he has worked with me for like years, and
That's amazing.
like gets me set up on Botox. He knows that Botox doesn't last me 12 weeks. It lasts me 9.5 weeks for whatever reason. Whatever mysterious reason that is. Insurance thinks it should last 12, but it's like, it doesn't for some reason.
Did
And
he help you
so
get that approved with
he like helped
insurance?
me like get that all like, like taken care of. And like, he's amazing. And so it just, it's like, I think the thing I did right is just like keep going. Like, I just like kept looking and kept going, and didn't just completely give up after like some bad experiences, because yeah, the beginning was just bizarre and awful. And then I think of these people who don't have the resources and don't, have the ability to keep looking, and,
Yeah.
it'd be awful.
Yeah. Can you tell me maybe a little bit about what your typical clients look like in private practice?
Mhm.
You know, age and experiences. What do you tend to gravitate towards one type of, or not just one type, but gravitate towards, a general client?
So I've got kind of a range. I see adults, so like my youngest client's 22, but then well, I guess I've got a 25-year-old too. So young adult to adult. And then they're all pretty high achieving. Like, even my chronic illness people are all pretty high achieving. They push themselves pretty hard. A lot of what we work on is like, are you sure you should be working? It's 8 o'clock at night. Slow down.
Yes.
And so it really is like a big focus of our work is like boundary setting, and them not wanting to like use their chronic illness to like, get out of doing stuff, and it's like, it's not really getting out of stuff. It's just, acknowledging that like you need a break.
I know. I've got some clients like that, and the way that I explained it is like, this symptom, it's not necessarily this conversation gets really tricky. It's not that stress just inherently causes a chronic thing, pain, illness, disease, whatever. But it does exacerbate. And stress kind of, if there's already think about like the weakest link in something, think about an anchor, and there is one link that's weak,
right.
And something crashes into that anchor, a large whale or whatever. That anchor might be incredibly strong and not break anywhere else except for that one link, which now everything is derailed from, the anchor no longer can do its job. So stress is like the whale, and it's not that we want to fear stress, but we want to figure out, why are we overworking? What is the guilt or the shame or the things that are coming up around that? So yeah, can you speak to that a little bit?
Yeah, I mean, I think the stress of wanting to do things perfectly and almost like overcompensating for the illness. I think a lot of times, like I have clients who have to miss work to go, to doctor's appointments, to go get infusions, to go get, procedures done. And so then they feel like they have to come back and like work, double time to like make up for that. And it's like, you have sick days. Like that's what those are for. That's, the point of them, is to take them. So, I think a lot of work around that, and just perfectionism in general. Like I work with a lot of people around like, adequate is like just fine, like being adequate is like perfectly okay. Like there's nothing wrong with that. You get your job done. You don't need to go like above and beyond and way, way above what was asked for. And so it's a lot of that. And but yeah, they, and then, chronic illness wise, I see a lot of migraines and Crohn's and gastroparesis and what else? Diabetes and different kind of like arthritis and kind of pain, like, fibromyalgia, that kind of stuff.
And especially in those, stress really does, it can really even bring on a symptom. Again, it's not that like the symptom wasn't lingering somewhere, but that high levels of stress really does just kind of illuminate it like fireworks.
Yeah, completely. And it just, we talk a lot about burnout and how, how much that can just accentuate, all those symptoms.
What are some of the fears that come up for people if they are going to try to stop working so much or overworking? What are some of the fears they have that keep them from doing that you then kind of help them work through?
I get a lot of people who are afraid that, like, if they let themselves rest, that they'll just like never stop, and I'm constantly telling people like, you're not the type of person. Like I have no concern that like you're gonna all of a sudden just like not do anything, because they're like so far in the one direction of like constantly working that like if you give yourself a little slack, you're not gonna all of a sudden go way in the other direction and just become a couch potato that does nothing and, never goes back to work. But that's a fear like that a lot of people have, where it's like, I'm gonna give myself this little bit of slack, and then I'm just gonna like stop. I'm
Well,
just
it's
gonna
funny.
completely stop working,
As you said that, I'm like, it's funny, the fear of like, if I rest, I'll never stop resting. But they're not scared of the fact that if I work, I'm gonna keep working. and when I say they, I fall in this category. So please, y'all take this with with a lighthearted air about it. I'm not chastising anyone. I definitely have to learn and relearn this all the time. I'll think, oh, I've learned the art of balance and rest, and then there's just a little bit too much white space on my calendar, and I'm like, oh, what can I fill it up with?
Well, and that's what I tell people all the time too, is like, it took me years to schedule, like to do my schedule, like as if I have migraines. Like I would, it'd be, I got them in 2016 and it would be 2020. And I'd be like, no, like I can do this. Like fill up my calendar. And even though like my head gets worse the later in the day I go, I'd be like scheduling people at 4 and 5, and my boyfriend, it would drive my boyfriend crazy because he'd be like, what are you doing? And he's like, why are you scheduling yourself like you don't have migraines? And I'm like, well, because I don't want to have migraines.
I know,
like
as
I
you're
just
saying
wish I didn't have them. And it's like you just keep doing it, but I'm like, it takes a long time to like sink in and be like, oh, okay, like I actually have to like schedule as though my life is my life. Like,
no, that's such a good point. Like, I don't want to have them, so I live in this state of denial of like, maybe today I can. Yes, when I was pregnant, I had migraines almost every day, and there's nothing you can take
that's awful
safely when you're pregnant. I mean, there are
awful.
some. I tried a couple
take
different
like
things,
Tylenol or something, but
which does
like
nothing. Don't even try.
Does nothing. That's terrible. That's the only time mine went away.
Oh yeah,
it was like a nice respite for me of like not having
I hear that
them,
a lot,
but
like pregnancy bringing those symptoms away. I did have other symptoms that went away during pregnancy. But yeah, I was still working like 50 hours a week, and I was private practice and agency, and
oh
I
my
don't know.
gosh.
I mean, I took 4 months off though. But I think that's a part of the problem, right? We work really hard and then we crash really hard. Which is why I love, now I'm just in private practice. Then I filled my time up with a podcast, but it's much more on my own terms. Like I didn't post the Friday before New Year's. I try to publish every 2 weeks, and sometimes it goes every 4 weeks. Like it's happened 2 or 3 times. And I just have to like be kind to myself just, and know,
like, let it go.
Yeah.
I mean, doing agency and private practice has to be, that had to be really hard. And being pregnant and
I moved I moved home. And I got a puppy.
Oh my God.
It was a little bit crazy. But I will say,
I'm like, I knew when I was at UGA when I got pregnant. I was doing my postdoc when I got pregnant, and they offered me a job. Like there was a job opening for a psychologist, the next year. But I was like, it's 8 to 6 and I have to drive an hour to get here. And I was like, no, thank you. Just so gonna do private practice.
Yes.
Like, I'm just gonna go straight into private practice because it was, oh my gosh, yeah, because that's crazy. That
makes me think of some of the fears. The question earlier that I asked, like, what are the fears? And I think another one is like, well, if I don't take this opportunity, I'm never going to get another one. And this opportunity says I have to work 9 to 6. And if I don't take it, what's going to happen? So
yeah,
it takes, all the stuff that I talk about on this podcast, it takes a mix of hard work, luck, privilege, you know, as well as sometimes therapy or really good mentors, or it's a lot of trial and error and learning and failing and then learning more. And so really, I mean, the main skill we're trying to develop is being comfortable with challenge and continuing on in the face of challenges, because this whole thing is just a one big challenge.
Completely. Yeah, it is. And sometimes it's easier than others. Like, I think it's harder for me to challenge myself now because I've gotten comfortable. Like, it was easy for me to leave UGA because I was so used to being broke and a graduate student, you know, and my husband at the time was a graduate student. So we had no
Oh,
money.
man.
So I was like, well, I'll just start a private practice.
That is,
I
I
already
like
don't
that.
have any money. I'm like, just do this. But like the idea of doing something like that now is like, oh my gosh, that's terrifying. Like, I can't do that, you know. It's like I've got an
Yes.
11-year-old and I'm like, I have a house, and you know, like I can't just, you know, do something like that now. But yeah,
Absolutely.
at the time it was like, whatever, we have no money, we'll just, you know, make this work. And so yeah, I think context is important too.
Absolutely. I like that
Definitely.
example. It's like,
Yeah.
yeah, fear, right? Like just moving past the
Mhm.
fear, realizing what you're able to do in your circumstances. And it sounds ironic, but
Mhm.
you were able to leave because you had no money,
Yeah,
not
yeah,
because
because
if
there
you
was
had more,
no
you'd be like, no, I can't lose
right.
this.
Yeah, I mean, I wasn't really giving anything up. I was just, you know, staying the same, and just kind of, I was used to it.
That is
Didn't
such a
make
good
much of a
example.
difference. It's like, yeah,
So I have
those,
two more questions before we go.
yeah, sure.
I want to know if you can give listeners a piece of work-life balance advice, what would it be? And then this might also be in the same question. Do you have your kind of go-to confidence boosters when you're feeling down or not enough?
hmm So I think work-life balance is kind of bullshit.
I love it.
Um, because I just think it's like, I think when people talk about it, it's like this, I don't know, there's this like ideal picture in people's mind of like everything's in balance, and like I'm working the perfect amount and I'm at home the perfect amount and everything's like wonderful. And I just I think it sets up this false idea that like everything can be in balance all at once and that you can like stay in that place. I think you can have it for like a week and then you'll lose it and then you'll get it back again and then you'll lose it again, and you know, um but I think it is a matter of trying to just like figure out, you know, what a good amount of work is for you personally, and trying to stick to that, and realizing that like some weeks you're going to go over and you'll realize it because you'll feel it and adjust, and you know, some weeks you'll be under and that's fine, and you know, you can make adjustments as you go along. But yeah, I think it's, people talk about it like it's this destination, and it's like, I don't, I've never gotten there. So I think it's, you know,
It
I
reminds me of this
like,
speech. It went pretty viral this past year. And I'm trying to remember her name. I'll find, if you don't know who it is, I will find it and I'll put it in the show
mm,
notes. But
you know,
she talked about, um, she's famous, and she talked about work-life balance and how, like, yeah, when I'm, doing this over here, my house is a mess. And when my house is a mess,
right.
I mean, when my house is clean, I'm not doing so well at work. And when I'm a great mom,
Mhm.
so it's,
Yeah.
what are you willing to sacrifice at the time so that the thing that's most important to you at this phase in your life can get done?
hmm hmm Exactly. Because something, you know, it's like you either need help with parts of it, or like something's got to give. I mean, it just, I think it's hard to have everything in balance and find that like magical place.
Yeah. I think it's a
Um,
myth unless you live with, I mean, as part of it is just our culture, right? We're very hyper independent, but when you live, and there's problems that come with like more communal ways of living too, but when you live more
mhm,
communally or with your extended family and
right.
whatnot,
Mhm.
grandma's
Yeah.
cleaning the house every day and dad is
Right.
cooking every day, and like you're out working
Yeah.
and bringing money home for the groceries, and yeah,
Yeah.
so
I mean, if I had a personal chef and housekeepers coming every day and, all
your
that
work-life
stuff, I'd
balance would be
be,
great.
and be all set. But as it is, no one's volunteered to do that yet. So I just
Love it.
haven't found it yet. But I have gotten better at it. And I think that is the thing. Like, I think you can get better at it, and I think you can get close where it's not like completely out of whack. And I think for a long time I was like completely out of whack, which was making me sicker. So I do think there is like progress to be made, to where you can get, decently close. It's just not going to be perfect. But I think you can find a place where you're like, you know, getting there, you're getting close, to where
Yeah.
you're not like making yourself sick with stress,
Right.
and that kind of thing. So
When you get better, your skills improve in different areas, and then it doesn't take as much energy to maybe cook or clean or do this thing at work, because you've learned how to be more efficient or decided what's
right.
important and what's not.
Hmm.
So then, yeah, you're able to feed yourself every day at a certain point, and then you can focus your energy on learning to do something else.
Right.
So with
Yeah.
time and age, it does get easier. I can attest to that too.
Hmm. Yeah.
And so
um,
lastly, yeah, do you have any go-to confidence boosters that you kind of use when either you or your clients are feeling down or not enough?
yeah, so I was thinking about that because I'm really bad at like cheering myself up when I feel that way. And so I was thinking about like what I do when I feel that way, or like how I try to manage that. And I think there's a few things I do. Um, I generally talk to the people that care a lot about me and try to get their feedback or their input, because if I'm feeling that way and I try to say stuff to myself, I generally am like, you're full of shit. Like I don't believe it, so I'm just like,
Mm-hmm.
whatever, like you don't know what you're talking about. Um so I try to talk to my boyfriend, talk to my good friends, talk to my mom, talk to my son, and you know ask them to tell me something nice about myself, or something positive about myself, or something they're proud of me for, or anything like that like will help kind of lift my mood. And that seems to help clients too, because I feel like one of the downfalls of CBT is like, that whole not argument, but that whole conversation you can have with clients where it's like, they'll be like, I'm a piece of crap. And you're like, what evidence do you have that you're a piece of crap? And they're like, I don't know, but I just feel like I'm a piece of crap. And like,
That's
it
right.
just goes around in circles where it's like, they can list evidence that they're not a piece of crap, but then they're like, well, I still feel that way.
Exactly.
So
Exactly.
it's like, and so it's like, well, okay.
That's why I was so drawn to acceptance and commitment therapy and somatic experiencing, things like that, because you feel how
Yeah,
you feel, right?
right. Like it just, yeah, it's they are where they are. And so, having them, like, why don't you ask for some feedback from other people, like what they think of you?
Yeah.
And
internalize the fact, because we heal in relationship.
right. And so that seems to go a lot farther and help a lot more. And just gets them talking to another person about how they feel and like starting to have that conversation. So that's kind of my go-to for that, and for when I'm not feeling great.
Yeah,
Yeah.
that's great. Thank you for that. I think those are really great things to think about and try to incorporate more into our lives. Everyone who listens to this podcast knows I think relationships are the most important thing in our life. So any way that we can just connect in a way that helps us and it helps the other person, it's reciprocal. So yeah. Anything else you want to leave listeners with today?
I don't think so. I think I would just really encourage people to go to therapy if they have a chronic illness. I think it's really hard to deal with, and I think it's one of those things that can be extremely isolating, and it just, therapy or group therapy for it, I think can be extremely helpful. And I don't know that people always associate it with going to therapy. Like, I wish more physicians kind of recommended that as kind of an automatic thing.
I feel like a lot of them even have stopped or are scared to give mental health referrals because people, have really spoken out about you think it's in my head, I don't need therapy.
Right.
So just educating doctors, I think, on how to make that referral.
Yeah, but it's not like they're saying that. It's just, that people need the support. And because, I mean, I feel like it's just really helpful. Because it's a hard road. I think it can be really helpful. So
yeah. Well, thank you so much.
Oh yeah, definitely. Definitely. It's a pleasure.
One more thing for the listeners. You had mentioned group therapy. So I do have a group currently running for people who are in Georgia. So if you are listening and you live in Georgia, you're looking for a group environment, feel free to email me, destiny@destinywinters.com.
Great.
If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need in order to better absorb the same lesson. Lastly, leaving a review really helps others find this podcast, so please do so if you found this episode helpful.